Each year, we select a speaker to share unique insights into the field of nursing at the pinning ceremony. This year, I'm delighted to introduce Dr. Rick Ricciardi as our keynote speaker. Dr. Ricciardi joined us at the GW School of Nursing as a professor after serving as the director of the Division of Practice Improvement and the Senior Advisor of Nursing at the Agency for Healthcare Research and Quality, or the AHRQ. He also currently serves as the president of Sigma Theta Tau International Honor Society, and those students who were inducted got a treat to hear from him earlier in the week. Prior to joining AHRQ in 2010, Rick served on active duty in the Army for 30 years and had numerous positions as a pediatric and family nurse practitioner, clinical scientist, and senior leader. In his last two positions on active duty, he served as Chief of Nursing Research at Walter Reed Army Medical Center and Director of Research at the Defense Centers of Excellence for Psychological Health and Traumatic Brain Injury. In addition to having experience in the clinical, research, educational, and health policy areas, Dr. Ricciardi has served as a board member for several community organizations, nonprofit corporations, and associations. He has served as president of the National Association of Pediatric Nurse Practitioners, president of the National Association of Pediatric Nurse Practitioners Foundation, chair of the Sigma Building Corporation, and treasurer and then vice president of Sigma Theta Tau International. Please help me in giving a warm welcome to Dr. Rick Ricciardi.
Wow. It's great to see you all, and to see you all being so excited. Remember that excitement. Put it to heart, put it to mind. Thank you to Dean for asking me to speak today. Thank you to fellow faculty, students, for the opportunity to do this. Distinguished guests, family members, loved ones, all who are here to celebrate you and your accomplishments, your wonderful accomplishments. Sometimes when we hit a milestone like this, it's important for us to take a step back to really realize where we are in the present. And if you will, just give me a second to put myself in your shoes when you were thinking about coming to GW and helping to make your decision. And I'm sure you looked at our website. And I want to take us back to the vision of GW School of Nursing. Compelled by the belief that all people deserve quality health care, we aspire, you all aspire, we all aspire, to be trusted advocates for the advancement of societal well-being in the clinic, the community, and the State House, or wherever we are. Universal health care, access to care, providing health equity. That's what we're all here to try to accomplish. I'm sure you took a look at you took a look at the mission, and the mission was to prepare leaders and providers to improve the health of all people by leveraging our presence in the nation's capital. Now, I hope you enjoyed your time in the capital. I'm sure many of you will stay here and have fond memories. But the importance is thinking about being here in the capital and what that means and the rule of law and government and how that will apply to healthcare. As you can see, many of the debates today are around healthcare. Now, lastly, before I move away from this, I want to take us to our values, the GW School of Nursing values. Integrity, collaboration, respect, excellence, openness, diversity, and courage. So I'm sure when you all were thinking about GW that you looked at those and thought about those and were compelled to say, they have meaning to me. These are not just words. These words require action. And I'd like to spend a little bit of time today talking about the last one, which is courage. It's going to take courage to move ourselves into tomorrow's healthcare. You are now in the solidarity. Some of you, I know there's some RN to BSNs here. But you are now in the collective group of nurses, 3 to 4 million in the US and 20 million worldwide. The largest healthcare workforce. We're at the ground level. We meet patients where they're at. We understand where they're at. We incorporate their values and their preferences, who they are as individuals. We understand that that's an important, critical element of nursing, to blend the science that you all are gaining with the humanity of being a person. At a time when you see them at their worst, laying on their back, obtunded, unresponsive, to at their best. I'm a cancer survivor. And you help me to be a cancer survivor. The essence of nursing, the blend of science. It's going to take courage, because healthcare in the US and many other countries is struggling. 18 to 19% of our gross domestic product. If you took healthcare, it would be one of the largest economic sources of nations. More than many other gross domestic products, just healthcare in the US. We have to be innovative. We have to be creative. We have to think about where nursing will be, but we have to be ever present to meet patients, families, and communities where they're at. That's challenging, right? To be ever present and not to lose sight of that presence, of the humanity, of the science, remaining evidence-based, but also looking to the future and have the courage to understand, one, where is technology leading us? And how nurses can be entrepreneurs and innovators and be creative to solve the solutions. How can we work interprofessionally with engineers, with artificial intelligence, with natural language processing, incorporating all the data and all the information to help us to drive health and wellness in the individual patient as well as the communities we serve. Create apps, yes, but also think of ways beyond that to where we can intersect technology, humanity, and science. Telehealth. Where do you stand in telehealth, and where will that be? Mobile health. Incorporating data from patients in the field and integrating us to help us to improve. All this distributive technology, working intensive cares and community centers, all that information being distributed to a central hub. How is that all being incorporated, and how is that getting back to communities? Whether you're in the acute care environment or the ambulatory environment, courage is necessary to withstand the challenges of everyday capabilities and the possibility of becoming complacent. Complacency is the ruination of science and healthcare. So always remain diligent to the feeling that you have today, the excitement you have today, the joy in your heart, as you seek to be courageous with the knowledge you have gained from yourselves, from these wonderful faculty, from your parents, from your family members, from the society that you're in, to move forward, to take nursing and your individual skills, leadership, and where you want to go to solve the most challenging problems, which is in healthcare. We just need to reshuffle the distribution of resources in healthcare. It's not about providing more money for healthcare. We have to be creative in taking the $3.5 trillion of healthcare dollars every year to be redistributed. That's on us to figure out how to do that. So I welcome you to nursing. You will not regret being a nurse. I've been a nurse for 40 years. And I can tell you, it's the best decision you ever made. Nursing is a wonderful profession. Be kind to each other. Remember that we're all in this together, and keep the joy and the remembrance of this day in your heart to drive you forward as you hit your lows to pick you up. Thank you very much. I wish you all the best.